Good afternoon, everyone. My name is Rachel. I'm one of the nurses from New York. I'm currently in a master's program in informatics to get far away from bedside. I want to leave bedside because of this typical workday, these four patients. The first one is extremely heavy. They ideally want 15 minutes per patient per hour. It's not possible. The first one is a trach patient, incontinent, pressure ulcers, tube feeding, is on isolation. Then I have a climbing patient that's consistently getting out of bed. Then I have a family which is emotionally draining. That is, why is the team balanced this way? It should be based on nursing acuity, not medically, but psychosocially.
Wow, thank you for sharing, Rachel. As a charge nurse, these are the pain points I hear every day, and this is the problem. Antiquated productivity care models do not account for psychosocial, non-medical needs, which leads to demoralizing nurse assignments. Our nurses are tired. They are leaving the bedside. We need to consider the weight of these needs on our nurses. So our solution, we created Holistic Acuity. It's an app-based platform to be used by nurses in the work environment. What we do is we have feedback from nurses on 3 psychosocial variables. We created this into a weighted score from 0 to 3, and then it can be used by charge nurses to help balance not only medical, but also psychosocial non-medical acuities. So next slide to see this in action. So this is a picture of Rachel's assignment. It has both the medical and the holistic on the far right table. If I was an informed charge nurse and I had this data, I could see that she wasn't maybe balanced medically, but now she's very unbalanced. I could have diverted some of these patients to other nurses on the floor. So in our market assessment, currently no nursing acuity tool assesses psychosocial and non-medical variables. There's medical acuities out there, but we're tapping into a new environment. Our tool will help bridge this gap. So in our business model, who's really going to be paying for this? Well, let's look at nurse turnover. That's where hospitals are paying it now. 18.7%, $40,000 per nurse, up to $6.5 million annually. The bottom table, if I go to my own hospital and apply these, we're losing 525 nurses. Those are my colleagues that are leaving. If we could drive this down to 10% turnover, even though we're still losing nurses, that's 9.8 million in cost avoidance for the hospital. So what are our next steps? We are in our infancy. This is our footprint to this. We know we need to work with that user engagement experience for nurses. We need to test reliability and validity of our tool, but we want to go into the market a little bit more. What about a nurse assessment rating index? What about pairing it with a little bit of AI to actually help prompt our nursing assignments? So the impact, this is where we see this gap. And the gap that's going to be filled is holistic nurses, or holistic acuity. Nurses want a nurse. We want to help keep nurses at the bedside for you so that they can maybe invest back into you. If you're a healthcare company, imagine what we could do with 20 nurses being retained and that extra $800,000 you could keep.